What do you think is the rarest blood type in the world? How many blood groups do you think there are in the world? 4 or 8? Both answers are correct, and at the same time incorrect. In fact, there are millions of variations of blood types in the world. Among them, golden blood is considered the rarest and most valuable, and there are only 43 people with this blood type in the past 50 years. To understand what golden blood is, we need to understand how blood groups work. According to curiosity, blood cells are covered with antigens to stimulate the production of antibodies. Which antigens you have depends on the gene variants of your parents. There are two main types of antigens, A blood type and B blood type are seen as dominant genes. And O blood type, without corresponding antigens, is seen as recessive genes. In another blood group, the rhesus D antigen, or Rh system, is divided into Rh negative and Rh positive. In fact, Rh positive is the group with D antigen, and Rh negative is the group without D antigen. According to the International Association of Blood Transfusion, there are 35 recognized blood types. But basically, each person only needs to know the two most important systems, ABO and Rh. Half a century ago, doctors believed that an embryo, without antigens, would not even survive. Antigen helps the baby's body develop in an independent and healthy way. In 1961, an Aboriginal Australian woman was determined to have Rh null blood type in her body. That means she lacks all the antigens in the Rh blood system. This is the pure golden blood type. Dr. Thierry Peyrard, the head of National Immunohematology Reference Laboratory in Paris, told about this strange blood. The Mosaic report asserts, golden blood is extremely important for medicine. Not only having an important role in saving people, the golden blood type also brings great scientific value. It helps scientists unravel the mystery of the role of the complex Rh system. However, this blood group, in blood banking systems, is very scarce and is only given to the most extraordinary cases. With a very small rate and scattered numbers around the world, if there is a case related to Rh null blood having a medical problem, it will be extremely difficult for you to locate the donor, not to mention international transportation of blood. Therefore, Rh null carriers are encouraged to donate blood as a means of insurance for themselves. Nonetheless, number of people agree to give, all around the world, just as the cutoff on each time they can give is still tiny contrasted with the present necessities. In the world, only 9 people are donating this blood type. Because it is so rare and sought after, all Rh null blood samples in the blood bank are anonymous donors. There are even some cases where scientists have tried to trace the origin and meet people with Rh null blood. They went to meet in person and asked for some blood for research. In 1964, Mr. Thomas was 10 years old. He went to Geneva University Hospital in Switzerland for being treated for a common inflammatory disease. When testing Thomas's blood, the doctors discovered something strange. Thomas's blood lacks all 61 antigens in the Rh blood system. He was identified as having the extremely rare Rh null blood type. This is indeed an extraordinary discovery for the hematologists at the University Hospital of Geneva. Mr. Thomas could not donate blood until he turned 18. Blood type is a genetic factor, so scientists in Geneva traced the origins of Mr. Thomas's grandparents. In the end, their blood tests showed that Mr. Thomas had Rh null blood type due to 2 random genetic mutations. The probability of that happening is extremely low. Mr. Thomas became the only member of his family with Rh null blood. Since there are only 43 people in the world with Rh null blood type, blood transfusion between people with this rare blood type is very difficult. To save a child in need of Rh null blood in France, Mr. Thomas had to travel from Switzerland to France out of his own pocket. He also went to France twice a year to donate blood, according to Fox News. The Rh null blood, or golden blood group, seems to be a result of genetic mutation or spontaneous change in the gene. It is commonly seen with mutations in the RHAG gene, which codes the Rh-associated glycoprotein. This protein is required for directing the Rh antigens to the RBC membrane. RHAG mutation is often associated with a disease called hereditary stomatocytosis. These individuals can have long-term hemolytic anemia and increased RBC breakdown. The Rh null phenotype can also be seen in the case of certain anemias that a person may have. The following conditions may put you at a higher risk of golden blood group. Consanguineous marriage. That is marriage between cousins, brother-sister, or anybody who is a near or distant relative. Autosomal genes. These are abnormal genes which have disease traits passed down through families. Changes or complete deletion of certain genes, which are RHD and RHCE or RHAG. The people with Rh null blood type usually may have the following cases. Mild to moderate hemolytic anemia since birth. This leads to faster destruction of red blood cells. This may cause low hemoglobin levels, causing paleness and weariness. Blood transfusion challenges. These people might face challenges during a blood transfusion. If this person's blood is exposed to Rh antigens, then proteins on the surface of red blood cells from another's blood, they readily form corresponding autoantibodies, and there may be a severe transfusion reaction. Therefore, for these types of patients, the hospitals need to have special protocols set and quick response management. Rh incompatibility during pregnancy. If the mother has Rh null and the baby has Rh positive blood type, the mother's blood gets sensitized by the baby's positive blood. Then mother's blood may produce protective proteins called antibodies that could lead to abortion or miscarriage. Hemolytic crisis. Several studies have found that any infection or sepsis in such individuals has precipitated massive hemolysis, subsequent kidney failure, and other complications. The answer is yes, golden blood can be donated. Due to the absence of antigens on red blood cells, a person with Rh null blood is considered to be a universal donor. This blood can be donated to anyone with rare blood types within the Rh systems. Rh null blood can be given to anyone with Rh blood type. But people with this blood type often face an equally disadvantage. They were forced to find somebody with the same Rh null blood type when transfusing, because their body is only compatible with this blood type. If you receive blood from someone who is Rh positive or has one of the 61 antigens that they lack, the person's body owing golden blood reacts with the receiving blood cells. The result is a series of fatal immune reactions. People with blood more precious than gold need to be especially careful in their daily lives. They cannot risk their lives by engaging in everyday activities because of being prone to injury or blood loss. It is also difficult for these people to travel, especially to any place where there are no rare blood banks, because they get difficult when storing their serum in a blood bank because its shelf life is only 35 to 42 days. Many cases are recommended not to give birth because it can affect the life of the child. Most people with Rh null blood type often carry their identity card, blood type certificate, and blood bank address. After watching this video, are you curious about this golden blood type? If you want us to make more videos like this, please comment below. Moreover, please subscribe to Ask K-pop Entertainment to support us for releasing more interesting video. Goodbye and see you next video.